death is a topic that no one wants to talk about. But what if I told you that talking about it could actually give you peace, dignity, and control over how your last days unfold? I'm going to tell you something about living will, one of India's most powerful yet misunderstood legal right. Firstly, what is a living will? It's also known as Advanced Medical Directive. So it's a legal document that allows you to decide how you want your medical treatment or how you don't want your medical treatment if you become ill, unconscious, or you're unable to communicate when you become old. So it's your voice when you can no longer speak for yourself. Think of it like writing a note to your future self and your doctor saying that please respect my wishes and do this. This became legal in India in 2018. 2018 Supreme Court judgment in the Aruna Schonberg case, a landmark case that recognized the right to die with dignity as part of fundamental right for life under Article 21 of the Constitution. But you know what? That time the entire process was too complicated. It required counter signatures from judicial magistrate and multiple layers of verification. That's why in January 2023, the Supreme Court simplified the entire procedures. You do not need a judicial magistrate anymore. The living will now just needs to witness and authentication by a notary. And you know what? The doctors must now verify and act on that will within 48 hours once it's presented to them. In Mumbai, Hinduja Hospital just launched India's first living will clinic just in June 2025. And you know, that first patient, she decided, a 80-year-old with lung and heart disease, she chose to limit her ventilator use to just 5 days, and she told she does not want CPR because she was scared of some relative's painful experience. It is not something extraordinary. It's basic dignity, guys. So we live in a culture where our families decide most medical choices. So the living will ensures a personal autonomy. Basically, it means that if you do not want to be kept on life support system indefinitely, you will not be kept on that. And your loved ones will also be relieved from painful, confusing decisions. And doctors will have a clarity about your choices and it's going to reduce any fights. So you will ask me how to do this in 2025. Write it. Clearly state your medical preferences, whether to continue or withdraw life support in case of terminal illness. Sign it by you in your sound mind. Get it attested, 2 witnesses you require, and a notary. And the last, nominate a guardian, someone who can communicate your wishes if you cannot do it. 5th, distribute the copies to your doctor, to your family, and to your local municipal authorities. I'm telling you, living will is the next big step in India's healthcare and estate planning, because digital health system is expanding and awareness is slowly growing. And do let me know about your thoughts in the comment section.